How are ya? I hope you're having a great day. When I was working on my Ph.D. and preparing for my first defense, I got so incredibly stressed out that my fibromyalgia flared up. I was in so much pain that if I sat down, I needed help to get back up. My back felt broken. My whole body was on fire and everything hurt. If I hadn't done my defense online, I don't know what I would have done. I wasn't capable of standing without help and would have needed a chair to do my defense. And that would have been really embarrassing. Today, I'll explain what radiculopathy is, the causes, and I'll share how I have worked through my pain. Here we go. You know, pain is subjective, but I think we can all agree that sudden shocks of pain can be really scary. When I was pregnant for my first baby, I would experience these sudden shocks in my lower back. I was only 22 at the time. I did my best to ignore it and never even mentioned it to my doctor because I thought it was something that would stop after I had my son. Nope, they continued, but only on the rare occasion when I twisted wrong or lifted something in the wrong way. I had to do 2 defenses during my PhD. After my first PhD defense, as I mentioned, my doctor wrote a prescription for steroids and a painkiller. I think I took that at bedtime. And then I was also sent to a physical therapist. Over time, I got better. She was wonderful and patient with me. But I continued to have these sudden, sharp shocks of pain in my lower back. So if I incorrectly moved my trunk, I felt the pain. My rheumatologist sent me to get an MRI. I think she was checking for neuropathy. They found Schmorl's nodes, which are common spinal disc herniations. I had these in my L5 to S1 area. I think that was around 2018. I had type 1 without herniations. And then a year later, I saw a doctor who did an electrodiagnostic test and said I had chronic bilateral L5 radiculopathy. Radiculopathy is a word to explain the pain that results from an entrapment of the nerve root, or what we call a pinched nerve or sciatica. These are located in the lower back. Symptoms may include sharp or burning pain in the lower back or buttocks, pain that extends down your leg, and numbness or tingling. The pain can travel from the spine, down the leg, and into the foot, depending on where the pinched nerve is located in the spine. In my case, I don't feel pain traveling down the back of my leg, but I do feel it in my feet. At least I'm recently thinking that might be the reason that I have pain in specific areas of my feet. I mean, I've been diagnosed with plantar fasciitis and metatarsalgia. In the lower back, pinched nerves can be anywhere from the L4 to L5 or L5 to S1 level. When the pain of the pinched nerve is located in one of these areas, we call it sciatica or radiculopathy or lumbar pain. It's in our lower back. But radiculopathies can occur on any part of the spine, the cervical, the thoracic, or lumbar. Symptoms vary for each radiculopathy, depending on where the pinched nerve is located, but usually, as I said, pain, weakness, numbness, and tingling occurs. Surgery is not often used as a treatment, so physical therapy is usually recommended. And that helped me a lot, but the pain, those sharp, sudden symptoms are always there lurking and waiting for me to twist the wrong way and cause it to spark. Do you experience this? The narrowing of the space where nerve roots exit the spine is a common cause of radiculopathy, which can be a result of stenosis, bone spurs, disc herniation, or other conditions. Radiculopathy cannot always be prevented, but our fitness level is important, and maintaining a healthy weight may reduce your risk. I'm hoping that the 32 pounds I've lost will help me in this area. If your job or the job you once had required heavy lifting, pushing, or pulling, it could be a factor into your back pain. If your job requires you to twist or vibrate your spine, that could also be a factor. Poor posture and stress can be a factor, but so can genetics. My mom had degenerative disc disease, and age is a factor. The intervertebral discs begin to lose fluid and flexibility as we age, which decreases their ability to cushion the vertebrae, and spinal stenosis can increase with age. Low back pain usually begins between the ages of 30 to 50 and becomes more common with age. I got my first experience of sharp pains when I was pregnant for my first child at the age of 22. So it can happen at any age. But if osteoporosis is involved, fractures, muscle elasticity, and tone decrease. So now let's talk about nerve and degenerative problems. We know that fibromyalgia can cause muscle pain and fatigue. So low back pain or pain anywhere in the muscles of the back can be caused by fibromyalgia, but there can be other causes. A herniated disc is a rupture in the fibrous outer wall of the vertebral disc. That allows the soft inner wall of the nucleus to bulge outward. The bulge can press harmfully against a nerve root. So this is one cause of lumbar radiculopathy. This is what it looks like. Degenerative disc disease is another cause. It occurs when a spinal disc weakens, allowing vertebral bone above and below the disc to shift out of position. The bones can touch, pinching nearby nerve roots. When bones, discs, or joints of the spine degenerate, bony spurs may form and push into the spinal canal. This is called spinal stenosis, and it can also create harmful pressure against nerve roots. Nerve root injury may occur at any of the 5 vertebrae of the lumbar spine, called the L1 to L5, or at the level of the sacral. The upper portion of the sacral is called the S1. Here's a picture. An injury of the L2 level can create thigh pain and hip weakness. At the L3 level, thigh pain and knee and thigh weakness can occur. Damage at the L4 level may cause pain from the lower back to the foot and also foot weakness. Damage at the L5 level can create pain from the outer leg to the top of the foot and also foot weakness. And finally, damage at the L1 level can create pain from the calf to the outer foot and also foot weakness. The following picture depicts the myotomes, meaning a group of muscles which is innervated by single spinal nerve roots. Foot pain can develop from nerve root compression or sciatica. I don't have any known illnesses that would cause foot pain other than from incorrectly fitted shoes. I don't have diabetes or MS, so I'm assuming that the weird foot pain on the outside of my foot and then the back of the heel may be from nerve root problems in my spine. Do you have any of these symptoms? Recently, like in the last month, I've started having heel pain. I was thinking that I had developed Achilles tendon or something like that, but during this research, I've come to realize that it might be from my sciatica. But of course, I'm still not eliminating peripheral neuropathy. The pain has been so bad in my heel that I wear slippers at home. They don't touch the back of my heel. I've put a little extra support in my shoe, even as I'm walking around, to give me a little extra comfort. It's been 3 years since my initial diagnosis of L5 radiculopathy, so it may be time to have it looked at again. But honestly, what are they going to do? I can do the exercises myself at home and keep it under control. But like you, most likely, a diagnosis always kind of makes me feel better, that these things aren't in my head. If you're curious about your low back pain, talk to your doctor. There are ways of getting to the cause. Bone scans, blood tests, discography, electrodiagnostics, which are an EMG, evoked potential study, or nerve conduction study. There are also diagnostic imaging tests like a CT, a computerized tomography, or an MRI, a magnetic resonance image, or X-ray. Or they may do a myelogram where they inject a dye into the spine to see what's going on with an X-ray or CT. And one last thought on this: when the nerve root in the disc is damaged, irritated, diseased, or compressed, I found that it can create a proximal peripheral neuropathy called radiculopathy. That's something I might have to look into. We know that neuropathy is damage to a nerve outside of the brain and spinal cord. So maybe I shouldn't leave neuropathy off the table. According to a 2018 study, researcher Edward Shipton stated that physical therapy can improve function and prevent disability from getting worse. Not one of the stretches are found to be better than another. You have to find what works for you. Too much rest and long-term medication are associated with worsening disability, so that's not recommended. Tai Chi, yoga, massage, and spinal manipulations may be recommended in combination with physical therapy exercise, but If you have lower back pain, exercises or stretches that have you bending at the waist can cause pain, like bending forward or bending backwards. So that's not recommended. Do those with caution. The years lived with disability from low back pain have gone up by more than 50% since 1990. The physical therapy exercises that I learned from my physical therapist to help me recover from low back pain are in the link below. I still do them in the morning before I get out of bed or before going to sleep while lying in bed. Some I have to do here during the day because I can't do them in bed. Hamstring stretch, modified lunge stretch, back flexion, or it's also called kneaded chest stretch, piriformis stretch, and that's my favorite. It makes my hips feel better, kind of stretches them a bit, and pelvic tilt, which I feel like I can't do this one very well. I just can't lift very well. But it's supposed to strengthen your back muscles. So I put a link to 3 different videos that show how to do these stretches in the description section below. I mean, they're my go-to for pain relief. But here's the thing. Yoga poses that involve hip rotations or fully bending forward or backward may cause pain in people with lumbar issues. So please avoid anything that causes you pain. And boy, that's way different than the last video when I talked about working through the pain. Recently, I've added a lumbar pillow behind my back as I sit in my computer chair right back here. It says, Nana, we love you. I started having middle of the back pain. Oh man, major pain. Tried to figure out what was going on, and I realized as I'm sitting here at the computer, I've been slouching. That slouching was causing my muscle pain across the back of my shoulders. Not good. So I remind myself to sit up straight. As you can see, I keep a lumbar pillow back there when I'm sitting in that chair. As we age, our muscles are not what they used to be. So in order to keep them working, stretches should be performed. Poor back muscle endurance causes a lot of issues. Your doctor might prescribe an analgesic like acetaminophen, or an NSAID like ibuprofen, or maybe a muscle relaxer, or a topical pain reliever like a gel, cream, spray, or patch. I have various different ones. Voltaren's really good. BioFreeze. These are my Salon Pause patches. And my favorite on my hips is this lidocaine patch. But you can also use heat or cold therapy or aquatic therapy. But listen, it's best you always consult with a qualified health professional or a physical therapist before trying anything you're unsure of. I just wanted to share what was working for me. But I'm not you. So I wanted to add this. How do I get stuff out of the dryer or the washer? I hold on with one arm as I'm bending because you got to get stuff out of the dryer. Well, the washer, I bend totally down and allow my body to rest on the washing machine. When I get stuff out of the dryer, I'm holding on with one arm while I'm taking out a little bit out of the dryer. You know, you do what you got to do, but you're careful while you're doing it. I hope you learned something. I send you gentle hugs and support. Love you. For numblet, in the lower back, pinched nerves can be anywhere from the all of the vertebral lip. When bones, discs, or joints of the spinal, and finally, damage at the S1 can create the S1 level. It's been 3 years since my initial. There are ways to prevent disability, and the and pelvic tilt, which piriformis stretch, discography,